is flu vaccine is typically mandatory. There are exceptions that can be made. And at times, if there's healthcare providers that refuse to get the flu vaccine, they usually have to mask with every patient, make sure that they take other precautions, etc. There's a level of privacy that has to happen because when you decide or do not decide to take the vaccine. So I'm not sure that any hospital is going to be able to say your healthcare provider is vaccinated or not, because that is private health information. But I think we highly encourage all healthcare workers to get vaccinated, not only to protect themselves, but obviously to protect their patients.
We had an internal discussion a couple of days ago because, it's pretty straightforward in our clinical settings, but we have several programs where home visitation occurs. And we're looking at what kind of parameters we really want to set for that. 5 million Americans have missed their second vaccine dose. This amounts to 8% of the total who received the first. Do you think this is primarily due to availability, fear of side effects, or complacency because of relaxed precautions?
Yes, and yes. So I think this is, the reasons. Well, there's a couple of things. One is some of those folks who haven't got their second dose are still intending on getting it. They just we found out that they're scheduling issues. They've got busy lives and they're going to get their second dose. But a lot of those who haven't gotten the second dose at this point, we do worry that they're not planning on getting the second dose. And there's all kinds of reasons why that might be, including that they've heard that with the second dose, you feel crummy for about a day. That's pretty common. So, we're going to have to wait and see. The other thing is that there are some folks who actually had COVID, got their first shot. That's when they got the reaction. And there's been some talk in the media about whether or not they need to get their second dose. And we still recommend that they get their second dose. But with that talk in the media, some of the people who had COVID got their first dose, they may now be thinking that they're all good to go, and they're not going to go back to get their second dose because of that. It's hard to know why people aren't getting their second dose, for sure.
It appears at sites like NRG, the numbers vaccinated have slipped by almost one half. Since we are not fully vaccinated as a community, is the supply outplacing the demand of the public in Houston?
Yeah, I think that I think we are at that point where we have vaccine available for pretty much every individual that wants the vaccine, and we have seen some decreases in demand. And it's a little bit hard to tease out whether it's because we had all these mega sites and people that are remaining don't have access to them. And so I know that both the Houston Health Department and Stephen and Dr. Persse can talk a little bit more about this, but we're moving towards trying to get the vaccine out into the community, out into pharmacies, trying to make it as easy as possible for people to get vaccinated, for those individuals that had a hard time coming to our sites or whatnot. But we are still struggling with vaccine hesitancy, and some people are still scared to get the vaccine. We saw that with the Johnson & Johnson pause, that maybe gave people more pause. And so we encourage these discussions, we encourage these types of questions so that we can continue to talk to the public and reassure them that the vaccines are effective, the vaccines are safe, and now the vaccines are more readily available than they were even just a month ago.
Yes, one thing that we're finding is that when we go into neighborhoods and we do door-to-door outreach, that especially when we have a vaccine clinic within a close proximity, that a number of people are willing to go and get the vaccine. So part of this is, I think, can be attributed to just access itself. Certainly there is hesitancy, there is a need for education, but I think that the strategy of going into the neighborhood will actually confront some of those barriers regarding access. Michigan needs more vaccines, and other states do not use what they have been given because allocation is based on population. It does not appear to meet the needs of the locations across the country.
So, we've been dealing with a little bit of, mismatch of vaccine delivery and where it can be used, and right from the beginning. So here locally, for example, between the city's health department, the county's health department, Harris Health, the county jail, hospital systems, other counties, we've been shifting vaccine around for weeks now as people had more here and there was a need over there. Now, in terms of doing it across state lines, that the federal government has to do that. And my understanding is from a recent conversation is that they're looking away. Surely within this region we've done it. I suspect that elsewhere in Texas there have probably been vaccine moved in even greater distances because we can all do that within the state. But across state lines, you require a way to do it from the federal standpoint.
I think the emphasis has been on ensuring that each state got its proportionate share. Right. Although we're a little behind on that one, but that was the intent. In Israel, a small number of those who received Pfizer experienced some type of heart inflammation. What have you heard about this?
So I've heard about a little bit. There have been a handful of cases, less than 10, I believe, of patients who've had developed what's called myocarditis. And the question with the report that I heard was the question at that point was because in Israel they've vaccinated a huge percent of the population. So Israel, if I remember correctly, has about 9 million people, and there's some very, very high percentage. So to have a handful of cases of myocarditis may be completely unrelated to the vaccine. And so they were investigating that first. But again, I think systems in place to catch these, what may be as rare as 1 in a million complications, or even, unrelated associations with the vaccine. So it's good that they were able to pick this up. Now we need to find out whether or not it's actually has anything to do with the vaccine or if it was just true and unrelated.
University of Illinois survey said many reported menstrual changes. Is this a common issue? If so, what are they?
Many reported what issues, sorry?
Menstrual changes. Is this a common issue? If so, what are they specifically?
Gotcha. And I think, as far as I know, this is something that similar to the myocarditis issue. It's whether or not it's truly related to the vaccine or not. I think some women are reporting that their period was delayed after getting the vaccine, or that their period came too early. And then we know that there's a lot on social media about fertility related to the vaccines. And I think right now, as far as we know, there's no relationship between fertility and the vaccines that will not affect your fertility. Whether or not it's affecting the menstrual cycle, I think still is left to be seen. But what we do know is that in general, stress can affect the menstrual cycle, and just there's so many different things that can affect it. And so whether or not it was the vaccine truly that it's affecting it, I think still remains to be seen. But it's not anything that we think is going to be what we say clinically significant. It's not something that's going to affect a woman's reproductive health or anything like that.
In the news, Houston Health Department underreported COVID-19 deaths from per KHOU 11. You want to take it, Dave? Go ahead.
Yeah, what I know about is that it's a relatively small number of cases. I believe it was 44 cases, and here in Houston we've got somewhere in the neighborhood of 2,500 deaths already. So it's a very, very tiny number. But these were individuals who are residents of the city of Houston who died elsewhere in Texas. And so like the city of Houston and Harris County, Fort Bend, Montgomery County, we're really good at exchanging data. But these are folks who died in counties far away. And when they died, and some of these, for example, were actually, they were nursing home patients, some of them, who their permanent residence was in Houston, and they may have been like in a hospital, in a rehab, reported to the local health department for where the person lived. It got reported to the local health department where the person died. Never got reported to us locally, went to the state. So it was available to us at the state register, but we didn't recognize that we had the ability to go and search that database for it. But it wound up being a fairly small number of patients. And yeah, it did go on for months, but it was a small number. And we now have recognized that we do have the ability to find those cases.
Actually, the state had that only happened with COVID. And when they gave it to us, we didn't recognize that we had it.
Oh, okay.
Okay. A Kaiser Family Foundation poll in March found that 50% of those who want to wait and see before getting a vaccine say that they would more likely to get it offered during routine medical visits to their own doctor. Everyone I know who has called their own doctor was told they have no vaccines. Is there an effort to involve the primary care physicians as people trust them more than mega sites? Absolutely. But y'all elaborate on it.
Yeah, and Dr. Persse and I were on a call earlier with the state actually, and this came up a little bit, and I think that we all acknowledge that. It just the magnitude of distribution of vaccine was so complicated that in the very beginning it just isn't feasible to get it into the hands of every doctor. And so the mega sites and the hubs really made sense to vaccinate a huge chunk of the population really quickly. But we completely agree with the person asking this question. A lot of people trust their primary physicians, and so there is a move to start getting vaccine into those clinics. Some of the vaccines are a little bit harder to handle though, and the cold storage, especially required for the Pfizer vaccine, not all primary care clinics will have that capacity to do so. And so there's still some issues and some logistics of whether or not all clinics probably will be able to handle COVID vaccination, but I think the goal is to make it as available as possible. And there are already clinics throughout the county, especially federally qualified health centers, that have been distributing and have been administering COVID vaccine in their clinics, and they've been doing this since the beginning.
A part of the issue also with private doctors' offices is the amount that is actually shipped. There is an effort from the state's part. I think that they've hired a contractor to actually break down the shipment into smaller quantities so that it would be more feasible to give it to private physicians. Counterfeit vaccines were received by 80 people in Mexico. In Poland, vials may have contained an anti-wrinkle treatment. Are vaccines in the U.S. safer?
So we believe that the vaccines in the U.S. are safer. Part of it is, and I don't know the particulars about what happened in Mexico or in Poland, but one of the beauties of the vaccine being free in the United States is it basically eliminates a black market for people to, make counterfeit vaccine, and then you can't sell it. Why would you sell it? It's provided free. So I'm not aware of any of this occurring in the United States. I do know that with my friends in law enforcement, there were lots of efforts to be on the lookout for it, but I've not. So we were, there was a lot of scrutiny about, looking to see if, unless Dr. Rivera or Stephen, if you know of any, I've not heard of any in the U.S.
No, I think it's something that we were worried about and we were on the lookout for, like you said, but it hasn't played out, luckily.
Pfizer vaccine confirmed to cause neurodegenerative disease, true?
Not that it doesn't ring a bell for me, no.
No, false, I think.
Moderna's vaccine is being reviewed for possible WHO emergency use listing. I'm really confused. Wasn't it already approved along with Pfizer? We know it wasn't approved with Pfizer, but...
So what they're talking about WHO, I think there's so many different regulatory bodies throughout the world that, like for example, AstraZeneca has been approved in Europe and other countries, but it has not yet been approved in the US. And there's just different protocols and different procedures and just different availabilities of the vaccine. And so that's probably what's happening, is that even though the FDA has approved Pfizer, Moderna, and Johnson & Johnson under emergency use authorization for use in the United States, that might not be the case in other parts of the world.
WHO has cautioned that smoking impairs lung function and may cause smokers to be more prone to lung infections, including COVID-19. This came up because there was a retracted paper that seemed to say the opposite.
Yeah. Well, look, smoking is really bad for your lungs. And your lungs, people don't always think of it, but your lungs are part of your immunologic defense system. Right? We breathe in lots of pathogens. Your lungs have got, a defense mechanism there from an immunity standpoint and from an infection standpoint. So when you damage your lungs, it only makes obvious sense that you're going to be more at risk for, the flu, bronchitis, etc. And COVID-19 it's at one level, it is just another viral illness that attacks. This is not a surprise.
Is there any local effort underway to assist countries like India who do not have enough oxygen for those in hospitals?
Yeah, I think as far as far as I know, I mean, this is mainly a question at the federal level, but the federal government is distributing a lot of vaccine now across the world. So I think the last report is basically all the AstraZeneca vaccines that we had are going to be distributed. A lot of them are going to go to India. There are efforts. There's grassroots efforts to try to get more assistance to India. There's federal efforts. Because we see the same pictures, we see the same trends of the hospitals in India being incredibly crowded and just not being able to handle the capacity. But there's efforts throughout in many different levels to try to assist.
Well, that was the last question. I really want to apologize for the technical challenges due to the staff emergency that we had this morning. But I want to thank Dr. Rivera and Dr. Persse for hanging in there with us to answer these questions. Every time I think that we're going to go, a shorter time frame, we end up going a little bit longer because the questions are more involved. Seems like there's still a lot of interest. Thank you for joining us for COVID-19 Talk with local health authorities. Joining us from Harris County was Dr. Maria Rivera. From the City of Houston, Dr. David Persse. Thank you to past President Kathy Fenninger of the Rotary Club of Houston. Thank you, Scott Packard, for filling in for us today. I'm Stephen Williams, the Director of the Houston Health Department.